We're now going to have a look at assisting a patient from lying to sitting on the edge of the bed. This is about minimal assistance and prompting the patient to do as much as they can to increase their independence as much as possible. So from here we've got lots of different steps that we're going to be going through to prompt a patient to go from lying to sitting. So the first thing we need to do is think about bending the knees. Then from here we would ask the patient to see if they can do a little shift away from me so that when they do the rotation they are not too far towards this side. So once they've done that little shift to the side, they can start bringing the knees down and at the same time bringing that hand across and looking. Now I'm going to be here to make sure that the patient feels safe. So from here we're on the hand. We've got the elbow there, facing this way, knees on the edge of the bed. We start bringing those legs over the edge of the bed, and then at the same time the patient starts pushing. If they get a bit stuck here and they're struggling, I can put one hand on the hips, one hand on the shoulder, and push down through the hips, and then assist them up to sitting position. Once they are in that seated position, but they're struggling to hold it due to a slight lack of core strength, if you do have a wedge, luckily I've got my colleague here with a wedge, you could put the wedge at the back, just helping them to keep sitting on the edge of the bed. Once you've got them in that position, I would be bringing the bed down so that their feet are flat on the floor. And then we need to start thinking about bringing the patient a little bit more to the edge of the bed so that they're ready for standing. Okay, good. So there are other videos around helping a patient to sit forwards in a chair, which we'll use in exactly the same way with the bed. So one of those methods, if you remember, is I can come down on one knee if I can, but if not, I can just remain in that bent fab stance. If I place my hand here, can you push your knee to touch my hand? Brilliant. Okay, and then I can walk around the other side and do the same here. Can you push your knee forwards to touch my hand? That's really good. And then we might need to move the wedge up a little bit again. So if you can go back, and what we'll do is we'll just pretend that the patient wasn't able to bring that knee forward, so we're just going to look at a slightly different technique. What I'm going to do is I'm going to assist the patient to bring each leg forwards. And coming down onto one knee, I'm going to hold the hip and the other hand just under the knee there. All I'm going to do is on the word move, I'm just going to bring your leg towards me, okay? So ready, steady, move. Okay, and then I'm going to come round and face the other way, do the same thing again. One hand on the hip, one hand just below the knee. And if you notice I'm sort of going in my direction, so all I'm going to do is bring my body weight back as I move that leg. So from here we've got ready, steady, move. And then on the edge of the bed, from there you might need to move the wedge in a little bit more, or you may even need to bring the bed height up a little bit to help them with standing, but that's going to depend on your patient and what they need.